There's content 5 again. Listing of the cranial nerves, basic physical stuff, knowledge of normal laboratory values. They really don't hit you too heavy on these values, but some you might want to pay attention to. Fasting glucose, I wouldn't worry about that. Cushing's disease, that's already been brought up. So the next section is 4, laboratory tests and assessment procedures indicating general assessment, basic screening panel, etc., what electrolytes, BUN, that type of thing. Which of the following labs are most appropriate when ordering lithium? And the answer is pretty simple. BUN, creatinine, electrolytes, and thyroid. But it's a little bit more than that. That's just the best answer out of the group. And this is for basic screening and appropriate use of the special populations, females experiencing first psychotic breaks, etc. What do you want to do? You're going to do substance abuse panel, including alcohol. WBC and differential electrolytes. And we'll come to that. I'm going to just skip all through this, and you can look at all these because I really want to show you all the content. This is differential diagnosis, so we're looking at the information, diagnostic information about a patient to establish an accurate diagnosis from among possible medical and psychological diagnoses in order to select appropriate treatment modalities. So stick with DSM-4 for any diagnosis right now, okay? But because they couldn't possibly be ready for 5, because 5 is not even fully done yet, unless somebody's seen a printed manual yet. Has anybody? I haven't. No, I don't think anybody has, so you don't have to worry about that, right? And then it would be a year or 2 before that would catch up. Okay, let's see. 2 is knowledge of psychological disorders that present as medical illnesses, such as physical disorders, fictitious and somatization disorders. And if you look here, what do they got? An example here. Excuse me, let me go back. Oh, we don't even have a question there, sorry. Knowledge of psychological signs and symptoms of mental status changes, memory dysfunction, depression, psychosis. Secondary to substance abuse, over-the-counter drugs, as well as alternative medications and supplements. So the therapeutically desired disagreeable sensations caused by drinking while on disulfiram are due to what? Both A and B. Inhibition of acetaldehyde dehydrogenase and inhibition of dopamine beta hydroxylase. Excuse me, I read that wrong. Interference with the conversion of alcohol to acetic acid. So it causes 2 changes: inhibition of the acetaldehyde dehydrogenase and interference with the conversion of alcohol to acetic acid. So that's what makes you feel uncomfortable when you're taking disulfiram. This is a varied presentation of psychological disorders of different population. Here we're looking at depression versus dementia in elderly, ADHD versus anxiety, mania versus paranoid schizophrenia in African Americans, and so then there's questions along those lines. And then we get into 6, the 5th area. This is psychological testing, physical and laboratory assessment, and medication response to clarify diagnostic dilemmas. Mania versus cocaine abuse versus hyperthyroidism versus theophylline overdose. Number 6 is knowledge of dual diagnosis and comorbid conditions, double depression, alcoholism, schizophrenia, depression, and Parkinson's disease. Everybody knows what dual depression is, right? Knowledge of iatrogenic effects of medication versus primary symptoms of disease. Supposedly coming out in May, yeah. Thanks. symptoms of disease progression, such as akathisia versus anxiety, depression versus negative symptoms of schizophrenia, anticholinergic reactions versus dementia, medication-induced tremor, dystonic reaction, or tardive dyskinesia versus primary movement disorders. Now we have content 7. Now this is pretty straightforward. So a lot, 12%, so you can guess what they probably want. We're going to get into pharmacokinetics, pharmacodynamics, and pharmacogenetics. And knowledge of drug classifications, okay, stimulants, etc. Which vitamin is essential for clotting? Everybody should know that, vitamin K, right? Knowledge of drug classifications for psychotropic, still part of this recognition. Other drugs used for the practice of medicine over the counter. Serious side effects. So we've already asked that question about disulfiram. A prodrug. Are there any prodrugs that we're currently using? Anybody know? That's a good question. There is one. Very good, Tony. By names. Everybody know what a prodrug is? Yes, yes, everybody knows what one is, requires metabolism, right? So what would be the answer to this question? It's less potent, right? Because of your hepatic dysfunction, right, you're not able to make the drug active from the prodrug state. So yeah, so you get this, becomes less potent. So you'd have to give a whole lot more drug. Let's see, and then knowledge of biological factors affecting these things, pharmacokinetics and pharmacodynamics. And we have same thing. Let's skip ahead. So I want you to see all 10 or 11 categories. Rates of absorption after oral dosing, perennial injection, or area under the curve, timing, basically the way you give the dose of the medication. Knowledge of distribution, the plasma protein binding, and that's already been spoken about. Okay, these are the drug metabolism, understanding the substrate and inhibitors and inducers of the family P450 enzymes or other enzymes outside of the liver. So breakdown of the body's substances is referred to as catabolism. Here we go. Section 5, same type of thing. Okay, Section 6. Laboratory tests to determine renal failure include okay, you got it? Everybody got it? C. So A and C. BUN creatinine glomerular filtration rate, creatinine serum, creatinine urine, creatinine clearance. Okay. So this is elimination half-life. We know about that, right? We talked about that a little bit. All right, moving on. Drug properties and characteristics of therapeutic index, therapeutic blood levels, prescription doses, potency, bioavailability, efficacy, cognitive and behavioral manifestations of toxicity, and dose response relationships. It's a big category. And we have cellular adaptation, cellular signaling, ion channels, second messengers, neurotransmitters, sensitivity and supersensitivity. So these are some simple questions related to that. Oops. Okay, 12. Yeah, genetic expressions is number 11. Which of the following is the second messenger? Pretty obvious, right? Everybody would pick that out immediately. Too easy. Knowledge of the specific neurotransmitters, receptors, and modulators and neuroreceptors. It's the same kind of a thing. Which of the following is a catecholamine? You know that D is monoamine oxidase inhibitors. We already talked about this. Reduce the degradation of the norepinephrine. Atypical antipsychotics obtain their therapeutic results by what? Antagonizing dopamine, D2, and the 5-HT2A receptors. That's what makes it unique. Alright. So this is knowledge of theoretical relationships thought to exist between the neurotransmitter systems and the psychopathological conditions based on known mechanisms of action and clinical observations. So there's no question here. Serotonin hypothesis of depression, dopamine hypothesis of psychosis, nucleus accumbens hypothesis of drug addiction, and amyloid cascade hypothesis for Alzheimer's disease. So those are all correct. Drug-induced disease. So we have which drug is responsible for creating significant hyponatremia. You should know that instantly. It's always this one, oxcarbazepine, triliptol. What happens when you have hyponatremia? What does the person complain of? Anybody got an answer to that? No, not so much confusion until it's really bad. Initially, it's always fatigue. Right, Christine, you got it. Knowledge of drug-induced disease, dysfunction, and adverse reactions. So it's with hepatotoxicity, agranulocytosis, and dystonia is too much water fatigue. Yeah. Which drug is responsible for creating secondary angle closure glaucoma? Which one are you going to pick? Topiramate. Weight gain occurs the most with which atypical antipsychotic? Y'all should know this really quick. Probably, yep, C. Which of the following populations is likely to experience greater EPS? Asians. That's important. They're likely to have that nowadays. Something like that. Which of the following is not true for TCAs? Asians tend to require lower doses. African Americans may respond to faster, but may respond faster, but with greater. And that doesn't make any sense. That's a bad question. Hispanics may respond at lower doses and experience greater side effects. Asians tend to require higher doses and respond more slowly. And this is with what kind of a drug? A TCA. It's that last one, yeah. Okay, and this is knowledge of pharmacoepidemiology. And then 8, okay, this section. There's no title. Here it is. All right. It refers to the application of pharmacology to the management of psychological behavioral disorders. This includes indications, contraindications, dosing, adverse effects, toxicities, etc. So we'll skip through this pretty quickly as well. Okay. So you have indications and contraindications, off-label uses, that type of thing. So what class of medication is first line for PTSD treatment? SSRIs, right? Yeah. Medication FDA approved for the treatment of PTSD is a sertraline. Okay. Here's this about the Stevens-Johnson syndrome. Okay. Increased with co-administration of valproate because in and of itself it can cause problems, which inhibits the metabolism of lamotrigine. And that makes it much stronger. So that was an interaction effect. Decisions in making strategies for psychotropic medication selection. Anorexia nervosa has the greatest comorbidity for which of the following conditions? It's depression. Decision-making strategies for psychotropic medication selection, risk-benefit practice guidelines. Again, it's a simple question. Decision-making strategies for psychotropic medication selection, risk-benefit, that's the same thing. So.
Was it about here?
All right, thank you. Yeah, I think so, yeah. I think we're a little further down, yep. So these are decision-making strategies for psychotropic medication, risk-benefit analysis, practice guidelines. Decision-making strategies, same type of deal. Knowledge of the rationale for psychotropic medication, selection, same idea. Still same augmentation strategies. You get into drug toxicities, management and reverse reactions, including overdose and indications for referral to appropriate medical care. Specific drug toxicities. Again, same thing, same topic. Relapse prevention, maintenance is a topic as well. And prophylaxis, strategies for sustaining remission of substance abuse, in particular, during treatment compliance and preventing reoccurrence of depression. Drug effects in special populations like the developmentally disabled, elderly children, pregnant and lactating women, ethnic and cultural groups. Says Epstein's anomaly, which includes displacement of 2 leaflets of the tricuspid valve towards the apex of the right ventricle of the heart, is associated with teratogenic effects of, and it's lithium. Epstein anomaly. That's what you would need to recall that. That's, I think, is typically asked. Come on, don't do that. Special population still, the antidepressant approved by the FDA for the use of pediatric patients has been what fluoxetine. Is there a new one out? Anybody aware of that are seeing children? Okay. C is the answer, that's right. Okay. Potential psychological and physiological manifestations of medications, including over-the-counter drugs. So you get a question like prenatal use of which drug is associated with increased incidence of ADHD, and it's nicotine. Yeah, it can be used now in age 12, right? So when you're actually going through the indications, that'll tell you for both children and adults. Severe depression may result from which of the following antihypertensives? It's clonidine and reserpine. Okay, same type of question. Let's see. Knowledge of psychological and physiological manifestations of various recreational substances and treatment of intoxication or addiction, including strategies assisted withdrawal and maintenance and relapse prevention. So which recreational drug is most associated with severe side effects, including hyponatremia, hyperthermia, cardiovascular instability, convulsions, and death? Number D. Good. Which recreational drug both releases and inhibits the reuptake of serotonin, sometimes provoking a serotonin syndrome? Yep, D. Okay, good. Drug-seeking behavior and potential for abuse. Drug-seeking behavior is motivated by dopaminergic circuits, glutaminergic circuits, tegmentum accumbens and prefrontal cortex pathways, A and C, and all of the above. It's all of the above. Educational techniques effective to inform patients of different cultural backgrounds about drug utilization, risk, benefits, potential complications, and pharmacology. I've not seen any questions for that yet. It's a new content area. This is content 9, which is about research, and it refers to methodology and standards and conduct of research in psychoactive substances. And I won't read all that. You get research designs, analytical techniques, so some of that information is in the book for you to access. And you have FDA drug development process, knowing the difference with these preclinical investigations and new drug applications, going through the process of all this, sort of and understanding it. Methodological issues in psychopharmacological research, like sample heterogeneity, drug sample, sample size, etc. There's a question for you. Michael, can I keep going? And is there a time you could put in? Well, let me finish this section and then I can ask you to do it, okay? This is another category, current status of research, evidence-based research regarding alternatives, and risk management strategies, reduction of medical errors, monitoring drug side effects, and the conduct of research. This is 10. This is ethical codes and standards as before. Okay, duty to warn, that type of thing. Least restrictive alternative can't mitigate without consent. There's a Cell versus U.S., APA amicus curiae brief, Gomez versus, these are just appeals that assist you in making a decision about involuntary treatment. Practice guidelines and standards of care of prescribing medications, they're out there a few. Laws and statutes for prescribing psychotropic medications, FDA regulations, Medicare, controlled substances laws, specifics of psychologists, licensing laws, and patients' rights. So, these are laws and statutes of prescribing medications, laws and this is the FDA, the Controlled Substances Act. We've already shown you that before. Issues involving collaboration, consultation with other healthcare providers, and provisions, patients' rights, and the last category is issues regarding the relationship with pharmaceutical companies, acceptance of gifts, revealing sources of funding, and affiliations. Those are the big clues. Diversity factors, this is what it's all about. This is a new category. The impact of diversity factors, for example, ethnicity, age, gender, role, culture, disability, and socioeconomic factors on research, assessment, diagnosis, and treatment. Some of this has already been discussed, but we have these genetic differences in drug metabolism and clearance. You have a category that's associated with, variations in health-seeking patterns as a function of diversity, genetic differences in drug metabolism, differences in adverse reactions to medications as a function of ethnicity and other diversity factors, and psychosocial factors and drug response effects. And I think this is, I believe 7 is the last one. Cultural and diversity of relevant assessment and treatment. And then I think this is it. Oh, no, I was wrong. Variations in trauma exposure and response. Yeah, there's 8 sections to this new category. All right, so I'm tired of this, and we don't want to do this again. Okay, so what I would like you to do, if you can, Michael, is put up the slides that's lab monitoring. A set of slides that are lab monitoring.